Hi, Dr. J. George, bariatric surgeon here. For this next part, I'd like to talk a little bit about our weight loss and bariatric surgery program. The program consists of two surgeons, Dr. Fred Teesinger and myself, as well as several nurse practitioners, dietitians, psychologists, support staff. That's all on the outpatient side of things. And then, of course, we have our main hospital that we work at, which is a Bariatric Center of Excellence, West Suburban Medical Center. The program is divided into two pathways. The vast majority of our patients go through the procedural pathway, which means that they are interested in and going for having a bariatric surgery at the end of the pipeline. A small set of patients who are not candidates for bariatric surgery because they don't meet criteria, or some patients who absolutely do not want to consider or don't want bariatric surgery, or maybe they're just on the fence about things. Those patients enroll in the medical weight loss program. And I will discuss the medical weight loss program in a little bit, but I want to focus on the bariatric surgery pipeline since most patients do that. And so the way that pipeline works is that when you come in to see myself or my partner, Dr. Teesing, in the office after you get a referral, and we've made sure that your insurance covers you for bariatric surgery benefits, as we sit down, we do an initial consultation. And especially for me, I typically spend a few minutes figuring out what you want, what your goals are, generally speaking, and also what your weight loss goal is, what your highest weight has been as an adult, where you're at now, what have you succeeded at doing, and where you're trying to go with your goal weight. So that gives us an idea of what we're shooting for. And I also have a little bit of a discussion about the program as well in person in the office. I also go through a personalized checklist with you in order to make sure that we're on the same page about what exactly we need from you in order to get yourself ready for surgery. So the first thing is that when you see us in the office, we're going to ask you to get plugged in with your diet classes and your psychology and nutrition visits and things like that, which is in a separate campus run by the hospital in a different location about 10 miles or 10 minutes away from our office. So there will be a phone number on the checklist that I'll ask you to dial right away, introducing yourself and getting yourself your appointments for your diet classes and things like that. There's also our office fax number on that checklist, and that's important because the second phone call you're going to make after you call to make your diet appointments is to call your primary doctor's office and to let them know that you've seen the bariatric surgeon and that you're getting plugged in. You need some labs and some records sent over to us, and that will be sent to our fax number. And so I'll go through that personalized checklist with you. A lot of things I'll cross off telling you that you don't need them. Some things that we do need, I'll circle. And basically, a lot of those things you've already done. So if you're a woman and you're up to date on your pap smear or your mammogram, or if you're over the age of 50 and you've had a colonoscopy within the last few years, those things just need to be sent over. And the reason I ask for those is because bariatric surgery is an elective procedure, and we don't want any surprises. We want you to be as tuned up and as healthy as possible before surgery. So if that means that I think that you have a high risk for obstructive sleep apnea and we want you to get a sleep study and get a pulmonology clearance, that's not because I'm trying to throw a roadblock up for you. It's because I want you to go through this process and have surgery as safely as possible. So the best analogy I can think of is that this is kind of like a space shuttle launch, and we don't want any loose ends. We want everything nice and packaged up and perfect, so that way the insurance company doesn't have any reason to deny us when we submit. And also, more importantly, we're doing a nice, safe surgery. I usually keep a copy of that checklist for my own records. I give you the original, and then you go through the process. And the River Forest campus, where you'll do your diet classes, will let you know how many classes you need, and that's entirely dependent on your insurance company. Some companies mandate 2 classes, some mandate 6, and you can't just go and knock out 6 classes in 2 weeks. It's 1 class a month. And once you've done all those diet classes and you've done those other things on the checklist and you've got your clearances as needed, we do what's called an endoscopy, which is also known as an EGD, which is a small procedure I do on all of my patients before surgery. It involves coming into the hospital for a couple of hours. It's a 5-10 minute procedure. We'll give you some sedation, put a little small camera down into your stomach and look for things like ulcers and polyps. And that's usually one of the last steps we do before I see you back in the office for a second visit. When you've completed all your clearances and done that checklist, at that second visit, when we sit down, we're going to discuss what kind of surgery we think is a good fit for you, and we'll mutually agree on a surgery together. I'll talk about the risks and benefits and details of that surgery on that second visit, and then we'll take all of that, submit it to the insurance company. Once we have an answer from the insurance company, then we will schedule you for surgery.